Assalamu alaikum everyone. Welcome to my YouTube channel Medbill Pro. I hope you guys will be fine and doing great and enjoying your good lives. Okay, so today we are going to start our third lecture. This lecture is going to be all about interview questions related to medical coding. Okay, so we have started our series of interview questions, so how you guys can just pass your medical billing and coding related job interviews. So in this series we have already covered our patient registration, insurance verification. Now it is going to be the third lecture that is all about interview questions regarding medical coding. So what are the basics of medical coding, and we will see all about in this lecture. Okay, so this lecture is basically, you guys can say that this series is for the freshers ones. Okay, so these will be the like basic questions regarding the medical coding. Okay, and let's start the lecture, I guess. Okay, so first of all, I would like to let you know guys that our services are all about the medical billing basic course. Okay, so we have completed our billing basic course. So if you want to learn medical billing basic course, then you guys can just go and watch the playlist. There are more than 50 to 60 lectures. Okay, so you guys can just watch all these lectures, and these lectures are going to be very beneficial and very helpful for you guys to learn medical billing. Okay, so if you are also looking for the medical coding course, then I have already uploaded the first lecture, and the next lecture is all about going to be over there. And there is also an other series that is going to be the international job huntings. You guys can just find different jobs in Pakistan, India, USA, Philippines, okay, and all other countries. Okay, so there are more than 20 lectures which have already been uploaded on my YouTube channel. So if you are wishing, and if you are looking for remote and work from home jobs, then you guys can just go and see all my lectures. Okay, so these were my services. So let's back to our lecture. Okay, so the question number first is going to be all about the medical coding MCQs. So as we have already started the quiz series, so in this quiz series I am just going to let you guys that we will be just covering different questions. So in today's lecture we are going to have 15 basic questions regarding the medical coding. Okay, so the first question is going to be, what does ICD stands for in medical coding? Okay, so this is the basic question and a simple one question. The option A is going to be International Classification of Diseases. Next one is Internal Coding Data. Third one is Insurance Classification Details. The fourth one is going to be the International Coding Diagnosis. So do you guys know all about this kind of a thing, like what is the abbreviation of ICD? Okay, so the option A is going to be the correct one, that is International Classification of Diseases. Okay, so you guys need to think about all the answers. ठीक है, आप लोग पहले ही अपने माइंड के अंदर इसके आंसर मीन्स के सोच लिया करें, ताकि ये है कि आप लोगों के ये जो क्वेश्चंस हैं ये आप लोगों को मीन्स के रिमाइंड भी हो जाए, आप लोगों को याद भी हो जाए. Okay, so let's see what is the question number 2. Which coding system is primarily used for reporting procedures performed in a hospital inpatient settings? Okay, so what should be the answer of this one? Option A is going to be CPT, option B is going to be ICD 10 PCS, option C is going to be HCPCS, option C is going to be HCPCS, Healthcare Common Procedure Coding System Level 2, and the last one, the option D is going to be ICD 10 CM, clinical modification. Okay, so what would be the answer of this one? So let's see what is the answer of which coding system is primarily used for reporting procedures performed in an hospital inpatient setting, and that is going to be the ICD-10 PCS. So the answer B is going to be the correct one of question number 2. Okay, so what is the question number 3? That is going to be the what is the purpose of CPT codes? Okay, so option A is going to be to classify diseases and health conditions. Option B is to describe services and procedures provided by healthcare professionals. C is going to be the to track medications, prescriptions, and D is going to be the identify the patient's insurance plan. So what is the basic purpose of CPT? Basically, what is CPT? Current procedural terminology, and the option B is going to be the correct one for this one. Okay, so this was all about the answer of question number 3. Okay, so now we are moving to the question number 4. Okay, so the question number 4 is going to be, which of the following is a key difference between ICD-10 CM and ICD-10 PCS? Okay, clinical modification and procedure coding system. So option A is going to be ICD-10 CM is used for outpatient coding, while ICD-10 PCS is used for inpatient procedure coding. Option B is going to be ICD-10 CM code diseases, ICD-10 PCS code surgeries. Option C is going to be ICD-10 CM is for billing, and ICD-10 PCS is for insurance coverages. And the option D is going to be ICD-10 CM uses letters, ICD-10 PCS uses numbers only. Okay, so what would be the answer of this one? So I'm just going to let you know, guys, that the answer of this one is going to be the first one, that is the option A. Okay, so as I just mentioned, the option A is going to be the correct one. Okay, so option A was that ICD-10 CM is used for outpatient coding, while the while ICD-10 PCS is used for inpatient procedures. So basic difference is going to be the between of ICD-10 CM and PCS is going to be that kind of a thing, like one is being going to be used for the outpatient setting and the other one is going to be used for the inpatient setting. Okay, so the option A is the correct one. Let's see what is the question number 5. What does HCPCS stands for? Healthcare Procedural Coding System, Healthcare Common Procedural Coding System, Healthcare Coverage and Payment Coding System. Option D is going to be the Hospital and Clinic Procedural Coding System. That is quite easy one. So the answer is going to be the option B. Okay, so Healthcare Common Procedure Coding System. Okay, so as you guys can see that this is the just quick and simple question. So that is quite good one. So you guys need to memorize this one. Okay, so the next one is going to be the what is CPT an abbreviation for? Option A is going to be current procedural technology. Option B is going to be current procedural terminology. Option C is going to be coding procedure tool. Option D is going to be the current physician terminology. So the option D is going to be the correct one, that is current procedure terminology. Okay, so CPT is, you guys know that when a provider is going to be provide any kind of a services and these services are coded into the CPTs. Okay, so if there is any kind of a diagnosis, then that is going to be coded into ICDs, and if there is any kind of a service that was provided, like you guys can say that procedure or any kind of a treatment which was done by or which was rendered by a healthcare provider, and that is going to be coded into CPT, current procedural terminology. The question number 7 is going to be what is a modifier in CPT coding? Okay, so that is quite important one. Option A is going to be a type of ICD-10 code, a code that describes a patient's symptoms, a code that provides additional information about a procedure. Option D is going to be a code that indicates the place of service. Okay, so what is the answer of this question is going to be option C. So what was that option C? So that is going to be a code that provides additional information about a procedure. Okay, so if a procedure is done by a healthcare provider, then if there is any kind of additional information or any additional treatment or surgery or any kind of a thing, then that can be represented as a modifier. So a modifier is going to be used with a CPT code, current procedural terminology. So option C is going to be the correct answer of this one. So what is the question number 8? That is going to be what is the purpose of HCPCS codes? For coding medical supplies, equipments and certain procedures. For coding surgeries only, for coding diagnosis, for coding laboratory tests only. So what is the answer of this one? So the option A is going to be the correct one. Okay, so A is for coding medical supplies, equipments and certain procedures. So anything which is not going to fall in under the CPT or current procedure terminology, that is going to be counted in HCPCS, healthcare common procedure coding system. Okay, like you guys can say that ambulance services, durable medical equipments, so and other kind of oxygen cylinders, so any kind of a services which were rendered by a healthcare provider. Okay, so that are not going to be fall under the CPT, then those are counted as or under as HCPCS. Okay, so the option A is going to be the correct one for this one. So let's see what is the next question, that is the question number 9. So what is the National Correct Coding Initiative, NCCI, used for? Option A is going to be to prevent coding errors. Option B is going to be to simplify the billing process. Option C is going to prevent incorrect coding and fraud. Option D is going to be to manage patient records. So the option C is going to be the correct one. So what is that? To prevent incorrect coding and fraud. So if any kind of a provider is going to do any kind of a incorrect coding, like if they are going to use upcoding, undercoding, mismatching, unbundling, so any kind of a thing which is going to be like do any kind of provider who is going to do this kind of a thing, then NCCI is going to find any kind of a things like that, and they are going to prevent incorrect coding and frauds. Okay, so the option C is going to be correct one. Okay, so that was all about the question number 9. So let's see what is the question number 10. That is going to be in medical coding, what does the term upcoding refer to? Okay, so as we have already mentioned and let you know guys that what is upcoding in the previous. Okay, so if any kind of a provider is going to do any kind of upcoding, downcoding, mismatching or unbundling, then that is going to be counted as fraud. Okay, so anyhow, we see that what is upcoding in medical coding. So that is going to be using a code that requires more detailed information. Option B is going to be using a more severe code than the actual diagnosis. Okay, so using the most accurate code available, or using a less severe code than the actual diagnosis. So as you guys can see that if there is something upcoding or downcoding, so means upcoding, then you are just going to add any kind of a thing like that is more severe than it was in actual. Okay, so the option B is going to be the correct one. Okay, so option B is going to be the correct one, that is using a more severe code than the actual diagnosis. Okay, so what was actually diagnosed, and the provider is going to code that kind of a diagnosis as a more severe situation. Okay, so that is called upcoding. Okay, so the option B is correct. Question number 11 is going to be, what does the abbreviation of DRG stand for? Diagnostic related group, disease related group, direct reimbursement group, or the option D is going to be the drug reference guide. So this is going to be the diagnostic related group. The option A is the correct answer. Okay, so next one is, what is the purpose of super bill in medical coding? Okay, so what does mean super bill in medical coding? This is a question number 12. So let's see, to summarize patient symptoms, to provide a detailed record of services rendered, to list all possible diagnosis codes, to provide insurance companies with the patient's medical history. So what should be the answer of this one, question number 12? So let's see. Okay, so answer B is going to be the correct one. Okay, so to provide a detailed record of services rendered. Okay, so any kind of a services which were rendered by a healthcare provider, so the provider needs to document or record all that kind of a stuff or data. Okay, so to provide a detailed record of services that were rendered, so that is going to be called as a super bill in medical coding. So the option B is correct one. What is the question number 13? What is the correct coding system to use for durable medical equipments, DME? Okay, so in the question of HCPCS or HCPCS, we have already discussed that what kind of things are included. Okay, so what kind of things are considered are included in HCPCS. So that is going to be the basically the answer of this question. So option A is going to be the CPT, option B is going to be ICD 10 CM, option C is going to be the ICD 10 PCS. Okay, so option D is going to be healthcare common procedure coding system level 2, that is going to be considered as like the answer of this question. So option D is the correct one. Okay, so this is the correct use of durable medical equipment. So the durable medical equipments, okay, and specified medications and ambulance services and like oxygen cylinders and crutches and these kind of services are considered under HCPCS, healthcare common procedure coding system. So the option D is going to be the correct answer of question number 13. So let's see what is the question number 14. Which organization is responsible for maintaining the CPT coding system? Okay, so you guys know that CPT codes and ICD codes are revised annually. So which is that organization who is going to update all that kind of stuff? So World Health Organization, HMO. Option B is American Medical Association, AMA. Option C is going to be the Centers for Medicare and Medicaid Services, CMS. Or option D is going to be the American Hospital Association, AHA. What is the answer of this question? That is going to be the option B, American Medical Association. Okay, so as you guys can see that who is going to be responsible for the CPT coding system, so maintaining that kind of a system, that is American Medical Association. Okay, so that is the answer of question number 14. So let's see what is our last question. So what is medical coding? Okay, so the option A is going to be assigning different codes to diagnosis and procedures, study of medical coding. Option C is going to be medical coding is following up on outstanding claims, and option D is going to be medical coding is entering patients data into a software. So what is the answer of this one? Option A, as you guys can see that assigning different codes to diagnosis and procedure, any kind of a thing that is diagnosed by a healthcare provider or any kind of a procedure that was done by a healthcare provider, so that is going to be coded into ICDs and CPTs, and assigning different kind of a codes is going to be the called as a study of like medical coding, you guys can say that. Okay, so the option A is going to be the correct one. So that was all about the 15 questions and the basic questions about medical coding. So thank you so much for your attention. Inshallah, we'll meet in the next lecture with different kind of a stuff in medical coding and billing. Okay, so this is a basically interview series. So we are just going to upload different interview questions regarding different steps in medical billing and coding. Okay, so inshallah we'll meet in the fourth lecture. So till then, take care of yourself and of your family, and do remember your kind prayers. And don't forget, if you guys have any kind of a queries or questions regarding medical billing and coding, then you guys can just comment on this video, and you guys can also send me your queries via email and my WhatsApp number as well. Okay, thank you so much once again. Take care. Allah Hafiz. Goodbye.